Alright, so moving to the next aspect of history taking and examination in obstetrics and gynecology. We're trying to look at a specific segment of that aspect of medicine, and that is what is called pelvic examination. Pelvic examination in history taking and examination in what? Obstetrics and gynecology. So pelvic examination just have to do with you are trying to access the pelvis, and of course you are trying to check out for any abnormalities. Okay, trying to check the pelvis, okay, with the help of instruments, with also your hand, and okay, any technique you actually get to use. So let's talk about the importance of this. So pelvic examination, of course, in gynecology you are dealing with what? The reproductive system of the woman, okay, the pelvis being the bulk of it, okay, apart from the breast up. So it's a very important aspect of physical assessment. So it provides direct insight into the health of the reproductive organs of the woman, okay, to see if there's any issues underlying. Okay, so it's essential for diagnosing conditions. It will guide you to know how to go about the treatment. All right, so and help you to know the type of test you now ask this woman to go and do. Do you understand? So what is the purpose? All right, to evaluate vagina, the cervix, the uterus. Okay, so everything you are accessing it. Investigate if there are symptoms, all right, pain and all of that. Screen for cervical cancers. Access pregnancy-related changes or complications. So components of pelvic examination is, first of all, you are starting from the outside. So here you are looking at the structures you are examining, and you are looking at the reasons why you are examining those structures. So the external genitalia inspection, that's what they are looking for. Speculum examination, this is when you use this device to kind of like put it in the vagina to keep it wide open. Then from there you can use a colposcopy or hysteroscopy to observe inside. Okay, so you are checking for vaginal walls, you are checking for the cervix, characteristics of the cervix, and you can also take up some samples, that's a vaginal swab or cervical swab, for pap smears or human papillomavirus testings. Then bimanual examination. This is bimanual examination here. One hand into the vagina, one hand on the abdomen. Okay, by two hands examination. So you're accessing the uterus, okay, for the characteristics, you can read it there. The ovaries and fallopian tube also for any symptoms. The rectovaginal examination, this is where you put one hand in the rectum, one hand in the vagina. Okay, so you're trying to evaluate posterior pelvic structures, endometriosis, rectovaginal masses. So this is the importance. It helps you to pick up all these conditions that may actually be hiding underneath. Okay, so that's the importance of the pelvic examination in history taking and examination in obstetrics and gynecology.